Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. So, what will this winter look like? We're now headed into Thanksgiving, and as of last weekend, we are at levels of new cases actually below where we were last year. So, is it low enough, and will we get another winter surge? So please share this with someone you care about as we look into all the factors. The most recent curve of cases is following closely the timing of last winter's surge. That surge took about 10 weeks to go from peak to truly low numbers. The peak in this most recent surge being the third week of September, roughly 6 weeks ago. 10 weeks puts us right at the first part of December, when we might see that. On the favorable side, in Haywood County, we have just about 34,000 residents, half the population, now fully vaccinated. And if we add in at least another 7,500 who we know have tested positive for COVID, subtract those whose lives have been lost, and add to that those who never got tested but were infected, say double those we know about, that leaves about 12,000 residents at risk, unvaccinated, with no immunity at all. Many of those now kids who can be vaccinated. And also remember in May, Delta was already on the radar screen, ravaging India before it took over here. This time, however, there does not appear to be a new variant on the horizon yet. All this speaks to an easier winter. On the other hand, though, several states are already now reporting increasing cases in the past 2 weeks, and here in Haywood County this week, cases have ticked up considerably. So far since last weekend, cases have gone from a low of around 9 total per day, that's about 15 per 100,000 on a rolling 7-day average, to around 20 per day average the last 2 days. And if that continues, we will have lived in the orange zone for a short period of time and be right back into the red very soon. Moreover, for Haywood County, this most recent surge added about 3,000 new cases that we know of. So with 12,000 Haywood County residents still at higher risk, there is more than enough of a pool of people for the virus to infect and drive several more surges. And our test positivity, although lower than 2 weeks ago, remains around 7%, above the important 5% threshold. Also factor in, we had no flu or winter viral illnesses last year. We have all been essentially 2 years since any significant exposure to these illnesses. There has not been much flu yet, but I would note that RSV, which is usually a winter illness among kids particularly, has been rampant for 3 months now already. So how tough is that going to make it to tell whether you or your child, what you're sick with? Because these all have such similar symptoms. Talk about people working and kids staying in school. And whether what is happening in the UK and Europe predicts anything for us, well, it certainly has kind of so far. And lastly, our hospitals remain full across the region despite the lowering case counts. COVID hospitalizations are down from September peaks, but hospital capacity is not up. And unlike last winter, when deaths came down as cases came down, in Haywood County so far, that does not seem to be happening. In fact, we're seeing the opposite. Cases are down, deaths are continuing to climb. And all of those are now among those not vaccinated. So let's be honest. If we all want to get this to a manageable level again, when it's not dominating our lives, recall, and by the way, we were there early last summer, and we can get there again, but for that to happen, you have to act. Each of us must remain vigilant not to spread this to others if you get sick, or even risk infecting others if you get exposed. Previous COVID does confer immunity, but adding vaccination makes that even more robust and reduces your chances of getting sick. A study released just last week in MMR found that people vaccinated had 5 times less odds of being hospitalized if infected again, compared with people who had previously been infected and recovered. And that's just one of several studies that make the point. Vaccination, even after acquired infection, gives you and your loved ones that you're around a better chance. So if you're not vaccinated and not being careful, well, in Haywood County, we're seeing deaths in much younger people. And if there's a winter surge, infection will certainly be more concentrated among those 12,000. So consider this, if you will. If I offered you a treatment for cancer that reduced your risk of dying by 10 times, would you choose to take that? Especially if it had minimal side effects? Now, I know many of you are worried about side effects, but consider what we know after nearly 4 billion doses given around the world. Whatever side effects concerns there have been about the vaccines, we now have plenty of experience over the past year and a half that demonstrates whatever concerning effects may come from the vaccine, they are also caused much worse by COVID. Those very same things, all the way more likely if you get infected, and lasting longer. Whether it's fertility concerns, pregnancy and effect to your newborn, blood clots, myocarditis, autoimmune issues, stroke, heart problems, lung problems, fatigue, all more likely and worse if you get infected. And if we want to not have a new variant worse than Delta, well, the fewer the infections, the fewer the chances the virus has to mutate, change, and be even more contagious and deadly. And if you don't like mandates, I get that. But let me ask you this. Is the risk to your health, your family's health, the community's health, and your livelihood worth it? I mean, sure, COVID has made our world much more unstable, uncertain, and unpredictable, more than it ever was. But is this really where you want to draw your line in the sand, trying to regain some predictability and some control in your life? Is that really your best odds to regain the life you want? So be well and be careful, especially right now.